Okay, good afternoon. My name's Janet Smethurst and I'm a team leader in Calderdale Public Health Early Years Service. We deliver health visiting, school nursing, breastfeeding, peer support and oral health services. So today I'm going to talk to you about a change we made in our 0 to 19 teams utilising the functionality of SystmOne to support a change in practice. These changes were initiated in response to the recommendations of a report into bereavement care led by the charity SANS. In 2020, Locala began the process of becoming compliant with the 9 standards of care related to the 5 national bereavement care pathways. Despite the pressures of COVID-19, we were able to achieve this. In order to meet the 9 standards, we reviewed current practice across both 0 to 19 services in Calderdale and Kirklees and worked in partnership with the Acute Trust. The following 4 standards are the ones which pertain to making the changes on SystmOne in order to improve the care that we deliver to our families. The first standard, a parent-led bereavement care plan, needed to be in place for all families in order to provide continuity between settings and into any subsequent pregnancies. Moving clockwise, the third standard, all bereaved parents are informed about and, if requested, referred for emotional support and for specialist mental health support when needed. The 8th standard, a system is in place to clearly signal to all healthcare professionals and staff that a parent has experienced a bereavement to enable continuity of care. And the final standard, number 9, healthcare staff are provided with and can access support and resources to deliver high quality bereavement care. We developed a bereavement care template which enables practitioners to capture the narrative around a baby's death or pregnancy loss, with the aim of having a specific place for the parent to tell their story. The process involved lengthy consultations across both 0 to 19 services across Calderdale and Kirklees, working closely with the SystmOne team. The bereavement template can be completed either at the time of the event or in the years following. Colleagues are not expected to be experts in bereavement care or to provide counselling, just to listen sensitively and record the parent's story, and if appropriate, discuss any further support that may be required. The bereavement template enables any further actions to be identified from the discussion with the family, which may include sharing information about charities who provide support specifically around baby death loss and/or referral onto specialist bereavement mental health support services. This type of intervention will be different from the referrals we may make from many of our other core contacts. Therefore, having a specific template to document this is preferable. When the bereavement template is completed on the SystmOne records, it populates a daisy icon under the patient demographics box when the record is saved. The daisy icon was chosen as it is a national symbol for bereavement used across the United Kingdom. It will signal to any healthcare professional who accesses a patient's SystmOne health records that they have experienced the death of a child or the loss of a pregnancy. We also designed a standardised condolence letter, which can be sent directly by SMS text message to the bereaved parent from SystmOne Letters and Communications. The letter contains the contact details of relevant organisations and charities, enabling the parent to access a range of grief support services and be in control of their own bereavement journey. There are also links to organisations who can support existing children with their grief. The letter contains the option of a home visit if this is deemed appropriate or if it's desired by the family. We uploaded a link to the bereavement postnatal care and support booklet, which was developed by our local LMS, which can also be sent by direct text message. The bereavement template gives the health practitioner a framework of care which is specific to pregnancy and baby loss, where identified support needs can be actioned, for example, a referral to more specialist support services. We also embedded links to the National Bereavement Care Pathway website and the Lullaby Trust onto the template to provide the practitioner with additional resources either before, during or after the contact, which can be explored with the parent if appropriate. We rolled out training across all our colleagues in the 0 to 19 services on the use of the template and the daisy icon. So being able to make this change on SystmOne was an important part of a process which has enabled us to improve the care we provide to service users, as well as meeting relevant care standards. SystmOne users can find a link to the guide for completing the template on the home screen, which contains screenshots of the processes involved. A link to the bereavement template is on all adult core templates. It can also be accessed from the parent folder on the clinical tree. We included some presets on so that the reason for the loss can be recorded with or without the narrative. So you've got a choice there. You can just put the reason for the loss if it's something that you wanted to record just as a professional rather than a parent story, or you can do both or either. The impact of baby loss cannot be underestimated. A new pregnancy can trigger grief even if it happened many years ago. This template gives a voice to that grief, as well as providing a tangible place to record the details and any actions which may be needed. The National Bereavement Care Pathway website and the Lullaby Trust can be accessed by clicking on the links on the template. Once the template has been saved to the patient record, an alert appears on the patient home screen and the daisy icon populates in the patient demographic box. If you hover over the daisy icon, you'll also see a snapshot of the entry. Providing the practitioner with this information reduces the need for the patient to tell their story several times over to different health professionals. Having this information readily available also increases practitioners' confidence to raise and discuss the emotionally traumatic issue of baby loss. To view previous entries, you simply click on the action button on the patient status alert, look in the tab journal, or click on the bereavement node on the clinical tree. So what we wanted was for it to be really easily seen on SystmOne. So by having a template that's accessed on the clinical tree and by these other means, it stops it from being lost in the historical content on the records. So it's always there and available. So throughout the course of this piece of work, we've been able to review current practice and implement new processes by developing a specific template to provide a framework of care which has been made possible due to the functionality of SystmOne. The feedback from practitioners has also been very positive, as has the feedback from parents. Colleagues feel they now have a dedicated place to record these events plus any actions. That parents really like having a place in their records where not just their grief can be acknowledged, but the existence of their baby too. And as always, when you start embedding new processes, it can highlight where else it can be applied. Children do sadly pass away, and this template can and has been used for child deaths over 12 months, so it's not just part of the National Bereavement Care Pathways. Interestingly, on the last training session, somebody asked if it could be used for parents who were bereaved following the removal of a child for safeguarding reasons. These parents are also bereaved, even though their child has not died. They have experienced the loss of a child. So we do need to acknowledge the lived experience of these parents and carers. So if practitioners and parents wish to use the template for this purpose, then this is an option as well. So that concludes the presentation, so I'm happy to take any questions.
Yeah, if anyone's got any questions, just pop them in the chat or put your hand up.
I'll stop sharing.
I think we just had just one question in the chat about whether you've shared the templates and associated documents to the SystmOne resource library. So that's the sort of national resource library with templates and questionnaires and resource across SystmOne.
No, but happy to do so.
Okay, yeah, perfect.
I'm sure, Kira, you can tell me how to do that.
I can help you with that. No problem.
Yeah. Okay, so thank you.
So if there's no other questions, I think we can. Oh, we've got a hand up. Robert?
Hi, Janet. It's
Hi.
Reece from Barnsley. I'm just with the patient status alert. Have you set a time frame on that? So I know bereavement does continue, and it's hard to put a time on it. But obviously, I'm guessing that's activated by a clinical report with coding that's on the template. Is there a timing? Because otherwise, that's going to stay on that record constantly, and that alert will be on constant. I just wondered how we address that.
So no, there's not a time limit on it. It's something we could put on, but like you say, something like bereavement, it goes on and on and on, doesn't it? And it might be that a woman has lost a child or a pregnancy 20 years ago, has another baby, had a baby at 17, has another baby at 37. So it could be relevant 20 years later. So it's not something that we felt that we needed to put a time frame on, but it's something that could be added. Or you could, you could add it. Yeah. Does that answer the question?
It does, thanks. Yeah, we've done a similar thing locally, and again, actually, a loss of a child, and looked at a patient status alert, and that was kind of the query that we had at that time, was do we put a time frame on it, which is difficult to get to that point from a clinical perspective. But it's yeah, I just wondered if that was something, again, the same that you'd done at your organisation. But yeah, thank you.
No, that's fine. I think with this whole process, because it was part of becoming compliant with the standards, it was about the patient story as well. So, and that's something that would never change. And you can complete that template again. It doesn't just have to be completed once. It could be, updated. So it's sort of a, it can be a work in progress, I suppose. If there's room for improvement, and if there's something that isn't working, then we can go back and look at it again. But so far, it's worked really well for us and really well for parents. Has anybody else on the call had something similar? Somebody says, what triggers a patient status alert, Daisy? So once you save the record, sorry, it flashed up then, I didn't see who'd asked that. Once you've saved the record, it automatically populates that Daisy icon, and then that will sit on the SystmOne record under the demographic box. So there's several places on the record where you can view this alert, where you can, get this information rather than it being hidden in that historical content in the records in the tab journal. By having that Daisy icon, you can hover over that, or it's in the alert, or you can access the template through the clinical tree. Does that answer your question? Sorry, they're flash. Let me just go to the chat.
So I was saying, is it the patient story code or a different code? So obviously you said the patient status alert is typically linked to a code that you add, it's added when you complete that template. So it's most likely, once you complete something within that template, it adds a code in the background, and then that will add your Daisy icon onto.
Yes. Yeah. So it's the same. It's the same code. Yeah.
Perfect.
Looks like we've got a hand from Caroline.
I'm trying to find how to put my hand down now. Sorry. Yeah, no, my only suggestion on the patient status alerts, we use them quite a bit in the 0 to 19 service in Hull. And the way that in terms of them not staying on and getting them to come off, we've utilised a sort of a superseding code so that the status alert will stay on unless superseded by a subsequent entry of a different code. So then you could have that sort of facility to say, right, well, by patient choice, they want or they're happy for that bereavement Daisy flag to be removed. So if you sort of did it by a entry into that template subsequently under a different code saying the patient has chosen that they want this to be sort of made, removed, then you could do that. We do that with quite a few things, and it works quite well, because then you're not having to remember to do it or set an expiry. It's done on consultation and patient choice.
Yeah, Yeah, I think that's exactly what we would do in our service.
The only other thing I'm thinking is because we have a community children's nursing service as well, and they do have, unfortunately, child deaths through that. We obviously would have to have the parents registered to document it for the parents, wouldn't we? It goes in the parents' record, isn't it? So
Yeah,
that's the only thing. It's fine in health visiting, but obviously in community children's nursing, we don't have the parents registered, which is something we'd have to think about doing in terms of if we wanted to offer, if the community children's nursing team were offering them specifically some bereavement support, I guess.
And they use SystmOne.
Yeah, they use SystmOne for community children's nursing. Yeah, so we would have to look at specifically registering parents for bereavement care within that nursing service, I guess. But it's really useful presentation. Thank you.
Thank you. I think we found that the GPs found it useful as well, because we've shared the information across across our patch with all our partner agencies that use SystmOne, and we do recognise not everybody uses SystmOne, but with IT support, this system can be replicated with other systems. But yeah, somebody's put the template isn't using read codes. It's using patient note options. No, it's not in patient note, it's a separate template. Is that what you mean, Jane?
Sorry, I think it was probably a question for the SystmOne people, because patient story isn't a read code, isn't it? So I was just wondering what functionality you were using on the template. So I am from Leeds Community Healthcare as a SystmOne developer.
Fine. I think I might be able to help with that. So I haven't seen the exact template, but just kind of looking at the that template entry is like it's a notes box, but that notes box is typically linked to a code in the background. So it would be patient story, and then you would type your notes attached to that. And they have made that mandatory as well. So we can put more.
That's what I'm thinking of, that it isn't a read code. There isn't a read code for patient story, so it must be using a different functionality that doesn't require read codes. So that was my query, but don't worry, I can.
We can put more details about what the linkage is between the that and the patient status alert.
And I can ask. Unfortunately, the member on our SystmOne team wasn't able to attend today. But it's Julie Roberts, Simon, so she would be able to tell you what type of code it is. Say that a lot, Rich.
Yeah,
More hands up. Not sure he was first.
There's a couple more hands up. Yeah. Do you want to go to Robert?
So it was just an answer to Jane's query, basically. Although there will be a code behind it, behind that notes box, you can change the description of it on the face of it. So I was kind of interested what codes were behind it, but there might be a specific code, but actually on the face of it, you can rename that to potentially whatever you want, as we know in templates. So although there is one behind it, it just will be, it'll have a different term to what's based on the template. Which
that's what I was interested in, because I suppose in Leeds we don't change names, but I think there is a different functionality that allows you to use a box without a read code.
I don't think there is on templates, but yeah, it's but yeah, there is a lot of changes in term, and we try to avoid that locally in terms of changing that term. But obviously we're dictated by what read and SNOMED codes are available or activating the certain SNOMED codes. So it's
no.
Yeah,
sorry, just to clarify on that, you can add in things that aren't read code related is a notes box, but they can't be reported on, so wouldn't be the one then triggering the patient status alert.
No, that's what I thought. Yeah.
So it must be a read code, but just not using the story read code. It'll be another read code, probably bereavement code in the background that they've used.
Because it's not actually that much you're using each month. That's to get them their money back, and then you'll be in credit next year.
Okay, should we go to Vanina?
Hi, yeah, I'm from Senate NHS Trust. We've had an issue with within our 0 to 19 service of when there's been a child death. What are you recording on, like the siblings records? So, say there's been a sudden infant death. Obviously, your process will be used on the parent or the carer's record. But are you writing anything on any siblings? Because we've had a few instances where, you know, someone's gone to see the sibling and not known that a baby's died in the family, and it's caused quite a few issues.
So this is only on the adult template, but you would be able to have this on a sibling record as well. But because it's a parent story, and because it was done related to the National Bereavement Care Pathway, then that's why we chose to put them on the adult templates. But you could definitely upload this onto a sibling and just alter it. You know, obviously it depends on the age of the sibling, but you know, these deaths and pregnancy losses do impact on the rest of the children that are in the family. But at the moment we've just kept it on the parent record, but it's something that we're going to be looking at. You know, once we've sort of audited the records that we've already got, then we will probably start uploading it onto sibling records. But yeah, I think it's definitely worked well, so I don't see why it wouldn't work on a sibling record. And then again, you've got that alert, haven't you, that you would have on their record that there's been a bereavement. Yeah.
Okay, thank you. And the other thing that we've had some issues with is the time frame of when a child's been marked as deceased on the spine. So by the GP. So we run other children's services, not just 0 to 19 ones, and sometimes people haven't been aware that there's been a death. So have you had any issues with that yourself, or do you wait for the notification from the spine? Or
we usually, well, it depends. We receive notifications of child deaths from various different routes. So we very often they come from midwifery services in the first instance, and we have very close links with our midwives. So I think sometimes it depends on relationships that you've got all existing, but it's child health that notify us of our child deaths, and then you know that information then gets disseminated down. I don't think very rarely do we get notified via GPs.
So if child health or a midwife lets you know that there's been a death, but the GP hasn't actually marked, to say it's a child death rather than a pregnancy or a miscarriage, the GP hasn't actually marked that child as being deceased on SystmOne. Our services have asked us kind of how we would alert people to the fact that that child's been deceased. So if another service opened the record, they wouldn't know that they deceased, if you see what I mean, because it's not been marked on the spine.
So is it the GPs that mark your deceased children?
Yeah.
Right. I don't think that's the same across the country, is it? On SystmOne, do you know that, Simon?
I would say potentially, yeah, but it could, in terms of SystmOne, it's just marking that as deceased within the record. So depends on who does it. It might be different in different areas.
Yeah, I don't think it's our GPs that do that. I think it's child health.
Okay.
So I don't know. But I think I mean it's what access you've got, isn't it? I'm not sure whether that's something you could change in your area.
It has to be the person notifying them of death. We don't ever mark anyone as deceased because we're not actually recording the death, doing the death notification, if you see what I mean. That's why it's GPs right, okay. In our area. So
GPs, right, okay.
Yeah. Okay, thank you.
Just to add, we've mitigated the risk around that by adding a high priority reminder onto patient records. So if we get a relative ring us to say that someone's patient's deceased, you know, in any service, we'll end the care of that service, but add a high priority reminder in the record to say that we've had notification of the patient's deceased, so that then if anyone else retrieves that record elsewhere, they'll be able to see that, if that helps.
Thank you. Yeah, that's what we were thinking of doing. That just confirms that's the right way. Thank you very much.
Okay, it's Chip. Got your hand up.
Sorry, that was me just replying, so not a question.
So what? Sorry, Chip. What do? You put
So if we've had incidences, like the previous person said, that the spine notification of a death arrives after a relative has contacted us to say that the patient has passed away. So there's a risk that that record is still active.
Yeah.
So what we do is we add a high priority reminder onto that patient record to say that we've been informed that a patient has deceased. We would end care at that unit, and then at some point the spine notification would still come through. And for us, it is generally the GPs that will record a death that goes up to the spine. Then the spine throws out tasks to any unit that the patient is under the care of. But sometimes, like I said, there's a bit of a delay in that process, and then we have had instances where inappropriate communications happened and caused some sort of trauma.
Do you let your those of you that are in 0 to 19 service, do you let your children's centres know as well? Once you've been informed of a child death, because we then inform our children's centres so that there's no communication that goes out from them. Or is that up to somebody else to do that, or is that your service that does that?
If we can see that they're under the care of another or open another unit, then we would advise them as well. Yeah, under our organisation.
Yeah.
Can I just ask another question? This is more maybe for TPP. Sorry to get onto the subject of deaths rather than this particular template. But we've had another issue, and I'd be interested to know if anyone else has had this, where when someone is marked as deceased, so if a child dies, it doesn't then pull through into any relationships that are on the system. So if you've then got another sibling who's got that child as a relationship, it doesn't sort of pull through automatically. Does anyone else have that problem, or does anyone, the TPP, have you got any plans to kind of make any changes around that or not?
So is this where a relationship has been made between those two records? Is that right?
Yeah.
And you've marked one record as deceased, and then you say that should reflect in the other record.
Yeah. If you opened up the siblings record, they would still have the deceased sibling showing as a relationship, and it wouldn't show that they'd deceased.
Right, got you.
Can you see in the chat someone's got around that?
Yeah, sorry, that was we kind of not got around it. I think what they're trying to mean is that when you mark a record as deceased, and that obviously puts the tombstone on, which is pulls from spine, that doesn't then actually indicate that in the groups and relationships for any siblings or parents. So you've got the date of birth that shows in there in the relationship. So the parents got that child as a relationship, but generally we update that as a textual entry, that the deceased, because there is no, although you've created a reciprocal relationship, it doesn't pull through the death if unfortunately that child or sibling dies. Is it? I think that's what they meant potentially. Sorry.
Yeah, I didn't know whether, I know that that's the way the system works. I didn't know whether TPP. Just asking cheekily if that's anything in the pipeline to like look into or anything.
Yeah, it's not something that I'm aware of, but I think is it Robert's put something within the chat where, you know, based on that information, you could utilize patient status alerts again in a very similar way that Janet's kind of demonstrated today, to then highlight when you do go into that record, an alert when you retrieve that the relationships record, or add a reminder or something like that.
Yeah, brilliant. Thank you.
I agree. That would be really useful to have that pull through to groups and relationships where it would amend them automatically.
Well, I think if no one's got any more questions, we'll probably close the session there. I'd just like to thank Janet. That was really, really useful. I'm sure everyone will agree, and it's just a nice way of approaching such a sensitive topic and making sure that everyone's kind of aware, and it can just be a nicer process for everyone, anyone that has to go through something so so difficult. I think if anyone's seen this today or any of the previous webinars and thought this is something that we've been doing or we've been working on in our trust or CCG organisation and something that you'd like to share, to get in touch with myself or Yutong. In fact, I will pop up the emails back on the screen so you can see who to contact. Yeah, if you've got any questions or want any further information, just drop us an email. And yeah, hopefully see you at the next one.
Thanks, everybody.
Thanks, Janet. Thanks, everyone.
Bye-bye.
Cheers. Bye.
Thank you.
Bye.